If you think it's the greatest season of the year, you're absolutely right. Yes, fall, the beautiful colors on the trees, the cooler weather inviting us to get back into the out there. But that, unfortunately, is not all, Kelly, that the season brings.
Yeah, I would say for millions of us, it brings the sniffling and sneezing from allergies, and it has been running high. Places like Oklahoma City, it's all about the ragweed. It's not as bad in places like Nashville and Raleigh, North Carolina, but it really depends on the weather conditions on any particular day.
There you go. Yeah, they can certainly be a mess. You know, not only are fall allergies a thing, but, you know, we've got a climate that's constantly changing, and there are times where it can get quite a bit worse than allergies.
Dr. Kasey Lanier is with us this morning. You're an allergist. You can explain why are we suffering this time of year. A lot of people think of spring as being the worst, but what is the count out there that's making us suffer?
Yeah, so let's talk about fall allergies. We normally do talk about spring allergies, and they get the bad rap, but 3/4 of people who have spring allergies also have fall allergies, and they're just as bad. So our two main culprits are weeds and molds. The most common weed is ragweed, and this is a real pesky plant that can generate 1 billion pollen particles just from one plant.
Okay, gotta ask you about that. Okay, so 1 billion particles from one plant, but they can also travel a very long way, right?
Hundreds of miles. Yeah, so they're kind of the worst plant right now, and then also we have our molds. Going back to ragweed, they pollinate from August until mid-October, but recently into November, so there's lengthening seasons happening now, and then too.
Super fast. With it traveling so far, is there any way to avoid it?
Yeah, great question. Alaska is the only state that can boast of not having any ragweed. So unless you're moving there, you're going to be hard-pressed to avoid ragweed altogether.
And you mentioned the mold. I think that's been getting me lately, too. Yes. But again, weather dependent, right? These things depend on the weather.
So mold, you want to think about wet vegetation, wet leaves, wet soils, wet logs. And if you can wear a mask outside, that's obviously the best thing, but after the rain, they really like to thrive in the humid conditions.
Okay, I got to ask you, how can you really tell if it happens to be, well, if you have some of the symptoms, is it allergies or could it possibly be COVID?
Yeah, that's a great question. So if you have notable itch, then you're probably thinking about allergies. Itching eyes, itching nose, that's going to distinguish you from a viral type illness. A fever would press you towards thinking about having COVID or another virus, of which there are many right now. Any other symptoms besides nasal and ocular symptoms, probably thinking about a more recent virus that you caught.
Yeah, usually a fever, I think, is a telltale sign, right?
Yes.
Okay.
That's not going to be associated with your allergies.
Gotcha. And of course, we're coming off a very hot summer. Just a few minutes ago, Reynolds and I were talking about how above average it's been, especially in the South. Does that come into play in terms of bringing on a worse pollen season?
Absolutely. So pollens like to be out when we like to be out. In the morning when it's warm and on warm, windy days, pollens are going to thrive. So that's when you want to avoid being out, unfortunately. After the rainfall, the rain does wash away pollen, but then it really revs up after the rainfall and after a thunderstorm.
So it's very temporary, that break.
Makes a lot of sense. I have to ask you, we talked about this during the commercial break. Are there things that you can do in terms of your diet that can improve your battle with allergies? Like, for example, hydration, does that matter?
Absolutely. Hydration absolutely makes a big difference. If you're thinning out your secretions, that kind of acts almost like a decongestant would. But as far as what you eat, less so.
And when do we need to see someone like you? When are these over-the-counter medications not really doing much for us and we need
great
more
question.
attention?
I mean, so allergies can be real mild or nagging, and they can be disabling for some people. So if you're just beyond not getting relief from the over-the-counter medicines, I would definitely advise you to come in and see what your triggers are. It's a simple skin test. It's not painful, and that can tell you exactly what you need to avoid. So I'd absolutely recommend that you come see us if you're not getting benefit. And then if you have any breathing problems, that's another reason to definitely come in and get a breathing test.
Okay, well, we've got viewers from all over America. And if some of you out there are sniffling and sneezing, this may be the reason why. Let's check out that forecast very quickly. And there you go, doctor. You'll see that the numbers do vary around America. But where it's high, you can see it right there. It's pretty extreme.
Right here. I mean, it has been running high. The ragweed especially, the mold has been off the charts, I have to say. All right, Dr. Kasey Lanier, thank you so much for coming in this morning and helping us out when it comes to fall allergies.
Thanks for having me.
So you have allergies.